Hello and welcome to the Cut the Noise mini-series on pressure ulcers. My name is Kirsty Mahoney and I'm the Senior Tissue Viability Nurse for the Welsh Wounds Innovation Centre. Yes, for some this is ASSKING and for others it may be ASSKING. We will go through ASSKING as it covers both. For this video we will be covered K, I, N and G. K stands for keep moving. Individuals that are unable to reposition themselves independently will need to be assisted, ensuring that appropriate equipment is used to promote safe mobilization. For example, hoists, slings, standing hoist, frames and glide sheets, appropriate seating and mobility aids. These promote self-motivation, including self-management of repositioning and early rehabilitation strategies if possible. And as always, document any necessary changes and frequency of repositioning. I stands for incontinence. Urine and feces may alter the natural pH of the skin and act as a chemical irritant penetrating the outer layers of skin, causing inflammation. Skin damage may also be associated with increased moisture, which may affect microclimate. And as we've already mentioned previously, microclimate is one of the external risk factors for pressure damage. If an individual is incontinent, ensure that incontinence is managed with appropriate incontinence aid, such as pads, sheaths or catheters, and consider a referral to the continence team where available. You will need to create a care plan to include a structured skincare regime, including cleansing solutions and skin protection, and document any interventions and referrals which should always be actioned. N stands for nutrition. Assessing nutritional status using a structured assessment tool should be undertaken and needs to include food and fluids intake and ability to feed self. Patients or carers should be given advice on food fortification and/or provision of adequate fluids, nutritional supplements and moderation of dietary requirements in the event of a pressure ulcer. Poorly fitting dentures or dental problems may contribute to poor oral intake, so should also be considered as part of the nutritional assessment, and all interventions and referrals should be documented. G stands for giving information. At this section of the framework, you should select and implement the most appropriate approach to increase awareness and facilitate concordance and engagement with pressure ulcer prevention strategies with a patient or carer. If there are any concerns over safeguarding, capacity or concordance, they should be escalated and documented as appropriate.